How about the girls?
Girls, we have to deal with what we call pyometras 1, and we talk about breast cancer or mammary tumors, okay? In this case, you're seeing breast cancer of the caudal mammary chain, and unfortunately, they have about 10 breasts. You ladies have 2, right? Imagine dealing with 10 sets of nipples and breast tissue, and this one ruptured. It got so infected,
Wait a minute,
inflamed.
when you say ruptured, like it
Pow!
Don't do that.
There you go.
I'm a vet.
Well, that's a rupture.
TSD.
I'm sorry.
Why you gonna do all that? Come on.
Keep it simple.
Have a show.
It ruptures. So that didn't just happen yesterday is my point. This bruise over time. Some point, this animal says, you know what, Dad don't get it. Mom don't understand. Unfortunately, she don't understand. I'm just going to take care of it myself.
But you're saying it's opened up like that when it came to you? It was already open like this?
Oh, yeah.
Oh, man.
Yeah. Nothing new. So in this case, we were fortunate enough to not only remove the problem, which is the infected carcinogenic mammary tumor, we were also able to spay her at the same time. Because the pyometra, which is the other issue.
That's the second line. That's the second stitch right there.
That's right. So it depends on the situation. But why do two birds, one stone to make it easier for everyone? Because I don't want you to spend a fortune on that breast. And I know, as a vet, the next battle is a pyometra, which we're going to talk about very shortly.
I want to talk about something right here because you did say the term spend. And I know a lot of our viewers, a lot of our followers, a lot of pet owners, there's a cost to having a pet, right?
Sure.
And you're saying that you did both of these surgeries at the same time, which I'm assuming came up to be a large total. But you're saying it was still less than if you would have had it done if you would have done them in 2 separate approaches.
Oh, for sure. Sometimes they're only able to afford one or the other. In this case, it's egregious. You got to do something about that. In this case, I just made the benefits very easy. Say, look, she's already going to be under. We're going to assess her for everything to make sure she's the best candidate for any anesthetic procedure, in this case, a mastectomy. Let me spay her too at the same time. I'm quick. As you can see, that incision is very pretty, and I'm really good at what I do. So I know this baby's going to benefit long-term from dealing with just, hey, rip the Band-Aid off. We're playing a ton of catch-up right now. She was in good standing health-wise outside of what we can see. And if everything matched up preliminary, do it.
Question for you. Could this have been avoided if they would have done the spay? See, I used the right term, female spay.
Absolutely. So if she would have done this or got this handled between 6 months and 8 months before her first heat cycle, there's absolutely very little chance that she would ever get a breast tumor.
Oh, wow.
Yeah. So, I mean, it's important. After about the second heat, and these guys get a heat cycle about every 6 months, after her second heat, it increases about 7% chance of getting a breast tumor or a cancer. And after her third heat, she's 1 in 4. Wow. 1 in 4 chances of dogs are going to get that regardless. So we'll talk about that when it comes to breeding, and you have the female responsibility because it's a high risk.
What as a pet owner, what can I expect to spend?
Which part?
This particular procedure, because I did a mistake. I waited a little long.
I know. So
what am I talking?
Location depends, right? New York versus Alabama prices, 2 different conversations. ER versus day practice. I believe this one came in about 2 in the morning. Oh. Yeah. So I'm the ER case. You got to pay to play. And, she was in a lot of pain.
Well, that's very similar to human ER, right? Because I know I've gotten a Band-Aid and some Neosporin from my daughter that busted her chin. 800. That was a discounted price. It started like $14.50. Now, like, what are we doing at $14.50? And doctor didn't even touch her. But so I understand ER has a different type of pricing. Yeah. But what am I thinking here?
I mean, anywhere honestly between $3,000 to $5,000 is reasonable, especially if you're going to get some excellent work. This one just happened to be isolated to just that one mammary chain, but a lot of times it's the entire chain that you have to remove. It can get very radical and very excessive. So it just depends on what you bring me, right? That's the key. And I'm going to do my assessment, anesthesia cost, pain management cost, invasiveness, and we didn't even talk about if she's even the best candidate for it, because a lot of times those conversations, what does cancer like to do? Metastasize. So I'm checking her lungs. I'm making sure it's not her liver or other organ systems that we can't see with the naked eye. Wow. And that's important. So that's why you really want to assess them. When I see that, you're concerned as a client, okay, is she going to make it? I don't want her in pain. I understand that. But let me verify what you brought me, because I'm only seeing the surface. If she could already have tumors in her chest that are metastasized, this is a different conversation.
Wow.
Right? So we're not talking, I'm not going to ever not recommend x-rays to you. Say, let me verify she's going to go under anesthetic gas anesthesia that her lungs are going to inhale, right? And if I don't see what's in that chest prior to it, she can either crash on a table or do extremely bad after the fact. I took the tissue, that was bad. I spayed her, but we didn't do our due diligence And at least I got to recommend to you. Now, if you decline it, I'm still going to have a conversation to say, hey, Unc, you didn't let me see it. I'm going to do it because we have to. And a lot of times you're emotionally charged. You say, hey, look, this is all I can afford. Just do what you got to do. If something happens, cool. You say that tonight. But next month, when she's not doing good, I promise you, you're going to say, Dr. Owens, since you made me cut this animal, she has been doing good ever since. You're going to go to the vet down the street. They're going to perform those x-rays that I low-key begged you to do with me, but I understand finances. And they're going to find the tumors all throughout her chest. And they're going to say, wow, they cut this dog? That's crazy. And I'm going to look like the bad guy. And of course, what are you going to do? Feel some type of way. So as long as
yelp all day long.
He's going to yelp, but I'm going to communicate the most I can, as effective as I can, because it's important you understand all the risk versus reward before I go into anything, right? Same as you.
I think a big point to add to that is, what would it cost for me to spay the dog? At the very beginning, she's a puppy. She's in her first, or before her first heat cycle, as you were pointing out, and I do it at that time.
Low cost, like very high volume, low quality would even cost you less than $100, right?
Good quality.
Good quality, $300 to $500.
$500 compared to the $3,000 to $6,000 I have to pay.
And that's being nice.
After all the pain, after all the suffering, because I'm assuming that the pet that we just looked at, she was in that situation for a minute. That didn't happen overnight.
Yeah. Oh, and by the way, if you let me send that tumor off, because now we got to verify, what are you? Were you naughty or were you nice? If it's naughty, it's probably going to spread to something else, just a matter of time. If it's nice, we got it. We marginalize it as best we can. I take a little bit of the obvious tissue plus a little extra. We call that good margins. And then I send that off for analysis. But then our fingers are crossed, and hopefully it's something decent that we can manage, and we caught it early as possible.
Something to think about. So there's a lot of things. Digest that.
Yeah.
But spay and neuter.
Spay and neuter.
Control.
In this case, spay.
Spay.